All right. We're still admitting people. Good morning, everyone. Thank you for coming to our presentation today. Um, what's fun is I don't have, okay, it's 11:01. So I think, thank you for letting everyone in. So today we're presenting, we've got three of us today. The presentation is I call 911, now what? And what to do while waiting for help to arrive. Um, I'm going to go ahead and I'll introduce myself. I'm Michelle Barkley, college nurse at Casumnas River College. We'll go ahead and go. I've got Samantha next. I'll let her introduce herself.
Good morning, everybody. My name is Samantha Juner, and I am the EMS instructor at Casumnas River College.
I am Monica Cummings. I am mental health clinical supervisor at American River College, and I'm excited and happy to be here with you all today.
Right, so we're going to go ahead and just kind of jump into the next slide and do this here. So what we have today, we have some objectives. What we're going to talk about today is to know that when you are in a emergency situation, it's okay to feel emotions and feel overwhelmed. It's not every day. It's not something that we rehearse. It's not something that happens all the time. But when it does happen, it can be a very scary process. And what we're going to do is review the process for calling 911, provide guidelines with assisting the victim while waiting for help to arrive, answer questions. If you have any questions at the end, what we're hoping to have everyone do, and we'll probably write it in the chat too, is if you have questions, please just go ahead and write it in the chat. When each of us are not presenting, we're going to be monitoring the chat. So that's going to be the best way to ask a question during the presentation. One thing we're going to also do for everybody is encourage everyone to take CPR, first aid in the community. And just to remind you, this is not a first aid CPR class. So, and then go here. And then, so this one, so as all of you know, like, so when you're waiting for help to arrive, you've called 911. Reminding you it's okay to feel overwhelmed. These are not situations that we are exposed to regularly. Take a moment to take a deep breath and not to panic. We just did, I learned this new exercise, and there's different types of deep breathing techniques, but this is they call it the 19-second pause, but it's called 4-7-8 breathing. So what you do is you take a deep breath, and you take a deep breath for 4 seconds. Hold it for 7, and then you exhale for 8. 19 seconds can, as you're going through whatever situation you're in, is gonna make a huge difference. Most importantly, don't freeze up and don't allow the stress to fear or paralyze you. Easier said than done, but just know that when you call 911, not only it's a lifeline to help. So know that after you've called 911, you're breathing, you're doing this, you've taken that step to help save someone's life. So that's very cool. So that's so they're calling 911. And why do we do this? Why are we calling 911? Well, it's a medical or psychiatric emergency that we're experiencing with someone. So this is the only system that is always available. So don't be afraid to, in the event of an emergency, don't be afraid to do that. We also, at the same time, we want people to call Los Rios Police LRPD, but call after you call 911. And what I'd like everyone to do here, I am going to take a minute to pause for everyone here. I know I can't. I think what I forgot to say too is if you need to have your camera on, for community, do, but if you need it off for self-care, we're very good with that. So please make sure that that you do that. What I want everyone to do is take out their phone. Everyone's got a cell phone. So at this point in time, I would like you to go into your, and I'm doing this right now too. Go into your app store, whether it be your app store or your Google Play or whatever device you have where you can download an app. I want everyone to download the Safe Los Rios app, because if you're on campus, this is the best app to have available in the event that you do need anything. With the Safe app too, it's not just it's not just for emergencies. If you need other things like a friend walk, a safety escort, it even has a campus map on it. And I don't know if you can, oh, okay, I'll try to keep it there. But once you get it downloaded, you have these resources at your fingertips, and it's valuable, especially, and like I said, we're back on campus, which is a lovely thing. It is lovely to be able to be back in person on campus. I mean, things have changed over the last couple of years. So we're back on campus, we're back seeing people in person. Hence, I think this being timely and coming, this presentation, that we're here again. It's great. And we could come upon situations now too, being on campus. And I just, is everyone doing okay with the, if you have any questions with the download, reach out. You can, it's on the website. Oh, thank you for the link. Yeah, so Monica just put the link for the Safe Los Rios app too. So thank you so much. But back to with this, so it gets in back to why we call 911. So with calling 911, EMS, Emergency Medical Services, has the right equipment to care for a medical emergency outside of the hospital. We here on campus, we have some AEDs, but we do not have the equipment. If someone does need, is having a medical emergency, medical or psychiatric emergency, and we'll go over the psychiatric at the end, please do, don't be afraid to call 911. Whoever the individual is, if you witness, if you're with the person, you're the best person to call 911. So call 911 and have someone else call LRPD if you're with a group of people. Okay. And so this here just talks about some circumstances necessitating calling 911. So there's a severe allergic reaction, if someone breaks a bone, if someone's having chest pain, difficulty breathing, a head injury, traumatic injury, major burns, possible poisoning, OD, seizure, suspected stroke, if they're unconscious or unresponsive, and mental health emergencies, and which focus more on immediate danger to self or others. We are going to touch upon if if you have a student of concern, but it's not an immediate danger, we'll touch upon resources with what to do in that case. All right, so what if you're unsure if 911 is needed? So call 911 anyway. It's the safest option for a victim. And this is kind of a fun thing too. If LRPD and the college nurse call 911, then do. So should you. 911 personnel will evaluate and advise the caller. So once again, if you're with them, it is added support, and it is wonderful to know you have that reassurance. And so the individual cannot tell you, someone cannot tell you not to call, but they can refuse services once EMS arrives. And so just know that is, and once again, kind of reiterating, it's the safest option. Call 911 and let EMS evaluate and advise. So here we're gonna, once again, it's the stay calm, breathe. I'm gonna remind you of the 4-7-8 technique, 19 seconds to help if you're in that moment. And, as you're doing everything, you can breathe, do that. Dial 911 from your cell phone or landline if available. And just I'm throwing this in here too, 20 years ago when I first started, we had phones. We didn't have, not everyone had a cell phone at hand. We had landlines in each of the classrooms with the Los Rios police stickers on it. I don't know if any of your classrooms or areas still have the blue stickers above there, or even the old flip chart. But this device has really changed our lives and how we do things nowadays. So yeah, from now, and actually what's nice is with your phone, the Safe Los Rios app, it'll call 911. As you click on what you need, you can call 911 from it. So it's a nice option. And blue phones around campus, I mean, honestly, our blue phone has become, we have this, which can acts like a blue phone. So that's why it's important to have the Safe Los Rios app downloaded. Little plug for that. And then, and I think from here, I think I'm going to be turning this over to Samantha.
Yeah. Hi, everybody. So I'm going to talk to you a little bit about what happens when you call 911. First of all, if you're in any doubt whatsoever, please give them a call. They are very good at assessing your situation. The best part of them is that they are going to be calm and help you get through this crisis. So you get them on the phone, you get them on the line. They're going to ask you to describe the problem, kind of give a generalized age and gender. You don't have to know the exact age, just a generalized how old they are, in their 20s, 30s, etc. They would like to know if it's a child. We do proceed things a little differently with children. Give the location of the emergency, the building and the room number. And then you want to go ahead and they're going to ask you to kind of describe what's going on, what is happening today. Basically, they're going to ask, why are you calling 911 today? They're going to want to know if the person you're calling for is active or lethargic, such as are they awake or not awake, agitated, are they unconscious, do they respond to anything at all, what are they complaining about. They will specifically ask about breathing issues and chest pain. Those are pretty high priority situations. They'll ask if they're having any symptoms of a stroke. Don't worry, I'm going to go over those with you so that you guys will know what the symptoms of a stroke are. If your patient is struggling to breathe, do we have any uncontrolled bleeding, big trauma involved, things such as that. All right, Michelle, next slide. Thank you. One of the biggest things to remember is do not hang up that phone, okay, until they tell you you can hang it up, all right? They like to keep you on the line, first of all, so they can keep you calm and give you advice. but also so they can assess if anything's changing, because they do like to update EMS crews as they are en route to your situation. The dispatchers are specially trained to assist you. They can talk you through a lot of first aid and life-saving techniques. So that is another reason why you don't want to get off the phone with them. They can guide you through almost everything you're going to have to do. All right. And like I already talked about, by staying on the line, they can continue to get information from you, any changes in the situation itself, any changes in the person you're calling for. Perhaps the initial call didn't require, say, law enforcement, but the situation's changing. So they're going to call law enforcement, or the initial situation didn't need like an expanded response, which we call it. And suddenly things are changing. So they decided they're going to need to call some additional personnel. And that's why we like to stay on the phone with them, so that as things change, because scenes and situations are always dynamic, we can make adjustments on that end and get more help coming to you. All right. Yep. All right. So now you called 911. What do we want to do? And you're going to do all this while you're on the phone with them. You can just put the phone on speakerphone and just set it down somewhere where you can talk to them. That way they can just monitor what's going on. First and foremost, let's make sure the scene is safe. Okay. If it's not safe, remove yourself from the situation. If you can take the patient with you by dragging them out with you, do that. But if not, we really want you to remain safe. We don't need you to also become a victim. Okay. So if it is safe, if we decided it's safe, no immediate threats or danger, please stay with the individual. Okay. So that you can help assess them and let dispatch know, so oncoming EMS crews will know what's going on. Wait for our local Los Rios Police Department to respond. They are trained in first aid, CPR, and mental health, so they will probably be the first people to get to you, and they do have training to help. Okay. If you have the time, this is if you have the time situation and the information, call the individual's emergency contact to let them know that there is a situation taking place. Continue to monitor the victim. Just keep assessing them constantly. If they're awake, just keep talking to them and asking them how they're feeling, what's going on. Anyone who's not actively helping should remove themselves from the space, or you should remove them from the space. It allows everybody to work more efficiently. And it also, most importantly, allows for some privacy for the individual having this emergency. They don't really like to have it blasted out there for all to know about. And if you're thinking about it, just start writing times down. This is when it started. Now perhaps they, it's getting worse. Write down, so we have a kind of a progression once EMS arrives as to how things are going. Okay, Michelle, next slide. All right, so you've called them and you're still waiting. If you have an unresponsive patient, the first thing you want to do is you want to check to see if they are breathing. Okay, super easy, just like you see on TV shows. Put your head down there, you feel for the breath, and you watch their chest rise and fall. Okay. If they're not breathing, call 911. You probably have already done that at this point. Then you should begin hands-only CPR. I know a lot of people are like, oh, I don't know CPR. I don't know CPR. That's okay. Hands-only CPR actually requires absolutely no training. So what you need to do is place your hands in the center of the chest and then just push hard and fast. That's all you need to do. That's all you need to remember. And the dispatcher on the phone will actually talk you through doing it and ask you to do that as well. If there's an AED available, and if you are on campus, there are multiple AEDs available, have someone go get it. All right. They are noted on our campus maps. So if you should maybe familiarize yourself where you live, work, and play on the campus, and know where the closest AEDs are to you, so you can know when to send someone to grab it. Once it arrives, you want to turn it on. You don't need any training to use an AED, so don't get worried about that. They're designed to be used by people with absolutely no training. So you just turn it on, and it's going to start to tell you exactly what to do, and just follow the prompts. Okay. The AED's smart. It does know what needs to be done. Okay. Next, Michelle. All right. So we have an unresponsive patient. Oh no. Okay. Yep. One down. Yeah. So consider if this is a possible opioid overdose. We're going to go over that a little more detail a little bit later. All right. Um, if they're breathing and they have a pulse, consider giving Narcan. We're going to go over the steps to doing that later on in this presentation. Narcan is pretty readily available. You can pick it up at the student health and wellness centers. We also have it in our AEDs around campus. And to be quite honest with you, you can go to Target or any store at this point. It's over the counter and buy it if you want to have it for yourself, just as a general rule. If you have it available, put on some protective equipment, mostly just gloves. If you have a mask and you want to put that on, that's perfectly acceptable as well. If they're unresponsive and we don't feel like this is a trauma situation, we don't have any head, neck, or spinal injuries, we can go ahead and roll them over onto their left side. We call this the recovery position, as it's kind of pictured there on the screen. This is just a way that if they're unresponsive, we roll them on their side. If they start to vomit or they start to have a lot of fluids in their mouth, it's just going to drain out and they're not going to choke on it. Okay. Speak quietly to the victim, reassure them. Even if they appear to be unresponsive, they may still be able to hear you. So just keep that in mind. We always want to keep talking to them, letting them know what's going on, and letting them know that you're there. You're there to keep them safe and to help them. Okay. I think this is for you, Michelle.
Hi, okay, so now we're going to talk about specific things that you may encounter. For instance, anaphylaxis is a severe allergic reaction. So you're in once we open up the cafeteria, you see someone, peanuts, nut allergies are huge. You see someone start to grab, maybe their airway is starting to close up. Um, so after you call 911, you ask the person if they're carrying an epinephrine or epi. You can just say epi as well. So a lot of times people have it who know that they have allergic reactions, and they can they can either self-administer, or you can help. So once again, if the person needs an auto injector, ask whether you can help. Or they more than likely can do it themselves, but if they're out, if you're not comfortable, that's okay. You can, I mean, this is a time where you can reach out and ask. You need to ask people for help as well. Have the person lie face up and be still, because you might have to start doing CPR on this person. But otherwise, if you can, a lot of times that recovery position is wonderful, because you can easily have them on their side and then just roll them back on their back if needed. Loosen tight clothing, cover the person with a blanket. If there's vomiting or bleeding, once again, we turn to the side to help. If there are no signs of breathing, coughing, or movement, then with CPR, if you're CPR trained, kind of a theme with this too is we're going to encourage getting CPR trained if you are not. And we can talk about that in terms of resources with where to go. An antihistamine pill such as diphenhydramine, which is Benadryl, it sometimes isn't enough to treat anaphylaxis. Some people take it, know that to take it ahead of time, but they can help prevent it. But epi is going to be their source depending on how much their airway is being constricted. Don't give a person with anaphylaxis anything to drink. So I'm going to go ahead and go to the next slide. And I think so we're going to now talk about someone possibly having a heart attack, chest pain, discomfort. So chest pain may indicate a serious condition. Always call emergency services. So easier said than done, because you're probably, it's a scary moment, but to encourage the victim to relax any way possible. And I think, and once again, that breathing 4, 7, 8, breathing will definitely come into play here. Allow for a position of comfort for the person. Rest, do not allow them to walk around, and reassure that you've called for help. And so the next one too, we have difficulty breathing, which could be a number of things. It could be, this could be the anaphylaxis. It could be that they have asthma. So once again, can be a symptom of many serious conditions. Just make it, if you can, try to make a space for them to be able to be comfortable, relax, call for help. So it reassure that you've called for help. And if they have any, once again, any self-administering medications, we talked about epinephrine, but there's also albuterol for those people that have asthma. So, so I'm still waiting. Oh, actually, I'm going to hand this off to Samantha.
All right, so we're still waiting. We're still trying to figure out what's going on, right? So suspected stroke. One of the first things is to learn what are some of the common signs of a stroke. So and this is exactly what EMS and medical providers look for. It's a very simple, straightforward way to assess for a stroke, which is why we use it. We want to ask them to smile, ask our victim or patient to smile. And if they have, and one indicator is if they have a lopsided smile, that's an indicator they may be having a stroke. Okay. Is their speech slurred or garbled? Especially if it was suddenly like that, like you were talking to them and in the middle of the conversation, everything just changed. Do they have weakness on one side of their body? It could be the whole one side of the body. It could just be one limb on that side of the body, but that's usually telling us they're having a stroke. And do we have any vision disturbances? Okay, did their vision start to get blurry? Did they start to get like a narrow visual field? Things like that. First thing you want to do is you want to encourage your the person to relax, because having them get very stressed out is not going to help anything. You don't want them to get their heart beating any faster. We really need to keep them very calm. We want to put them in a position of comfort. So whatever that means for them with this type of situation, that's fine. However they feel most comfortable, that is what we want them to do. We really don't want them to walk around. We want them to just kind of stay put right where they're at. If they want to stay seated, that's fine. Maybe they want to lay down, that's fine. Whatever they feel comfortable with. All right. Again, we're going to continue to reassure them and let them know that we've called for help. So additional help is on the way. Okay. So this is a really good key for you to use in order to determine if your patient is having a stroke. All right. Does one side of the face droop when they're smiling? All right. If you put both their arms out in front of them, straight out like in front of them, palms up, and have them close their eyes, do we see a drift on one of the arms? One will kind of drift down. That indicates that we're having some sort of a stroke. And then is the speech slurred or strange when they're repeating a simple phrase? And that is basically what we all use. You can't teach an old dog new tricks is the one most people use. If you see any of these, please, one of the biggest and most important things that you can convey to emergency services when they arrive is what time this all started. And the reason for that is treatment at the hospital for these patients is based directly on what time the symptoms start. So if you can't get any other information across, if you can at least tell us what time it started, that is everything in this situation. I'd like to also just point out real fast here that a lot of people might be inclined to take a person who's having stroke symptoms and pop them in their car and drive them to the hospital themselves, because they're not having trouble breathing or anything like that generally. And they feel like it's so fast, we got to get them to the hospital. And one of the things I'm going to do is discourage you from doing that. The biggest reason why is not every hospital is a stroke receiving facility. So if you wait for EMS to arrive, they will take them directly to the appropriate hospital. By taking them to the wrong hospital, it can delay care. And so that's one of the reasons we encourage people, please wait for EMS. They'll take them directly to the facility they need to go to. All right, Michelle, next slide. All right, perhaps we have someone with some broken bones. All right, first and foremost, we don't want to make anything worse than it already is. So we're not going to move them around unless we have to. Remember, I talked about scene safety before. So if the scene is unsafe and we need to move, then we should go ahead and do that. But unless we have to, let's keep them nice and still right where they're at. If you see any bleeding, we want to stop the bleeding. We're going to go over that a little bit more, but basically apply pressure to the wound, add a sterile bandage and a clean cloth or piece of clothing, whatever you have available to you to stop the bleeding. We want to minimize any movement to the injured area, all right, because that's just going to make the injury worse and it's going to cause a great deal of pain to the person with the broken bone. And we don't really want to do that. So if it's an obvious break and an obvious deformity, don't try and realign it. If the bone's sticking out through the skin because it's broken the skin, don't push it back in. Leave it as it is. It might look horrible. You know, visually it's going to be a little disturbing, but don't try and correct it unless you've been specifically trained how to do that. Okay. Otherwise, just keep them calm and leave it as it is. If you've been trained how to splint and medical assistance isn't immediately available, go ahead and apply a splint following all of the guidelines for splinting, which are we're going to splint above and below the fracture site. We're going to make sure none of the joints around the fracture site move, and we're going to keep everything nice and padded to help with our patient's comfort. We might see some swelling involved here, so we can apply an ice pack to it. However, we do not want to apply it directly to the skin because we can then cause a cold burn, right? A freezer burn. So make sure you have something, even if it's a single layer of cloth between the skin and the ice pack, that's ideal, okay? And then we want to look for signs of shock. What does that mean? Well, they feel like they're faint. They feel like they are having some problems breathing, or their breathing is really short and rapid. You know, things like that. They feel dizzy. They get very pale. Just lay them down, the head slightly lower than the rest of their body if you can. And that will help with their blood flow. If the legs aren't injured and we're not worried about some sort of a spinal injury, we can go ahead and raise the legs up just a little bit. It doesn't have to be a lot, and that will also help treat them for shock. All right, Michelle. All right, perhaps you have somebody who is bleeding and uncontrollably. Here, you definitely want to try and put on a pair of gloves if you have them available, but I don't want you running all over the place trying to find a pair of gloves. Bleeding is life-threatening, so we do need to remedy that as soon as possible. Find whatever you can around you. It doesn't matter at this point. We just need to stop the bleeding, all right? It doesn't have to be sterile. We would like it clean, but again, if that's not immediately available, use whatever you have at your fingertips. It does need to be absorbent so that it absorbs the blood. So you're going to go ahead, you're going to put that absorbent material on the bleeding site and you're going to press hard. It's going to hurt them a little bit, but you need to stop the bleeding. All right. Bleeding can take up to 3 to 5 minutes to stop. So don't expect it to be an immediate solution. Okay. And then we don't take that dressing off. Like it says here, we're not going to peek. No peeking. The reason why is because if we take it off, they've already started to develop a clot and we just pulled the clot off and now we're just going to restart all the bleeding. All right. If it bleeds through the clot that you have, just keep adding more and more on top of it. Okay. And just keep going in that motion. All right. If we're not dealing with a break again, go ahead and feel free to try and elevate the limb if it's the limb. That sometimes does assist us in stopping some bleeding. Again, let's not have the person walking around. We want to keep them in one space, encourage them to relax, put them in what position is very comfortable for them, and then let them know help is on the way. Okay, Michelle? So like I said, it might take 3 to 5 minutes for the bleeding to stop, but if it doesn't, we would like you to use a tourniquet. people get very afraid of using tourniquets because they're afraid that they're going to lose. But if I put a tourniquet on, it's on too long, the person might lose their arm. If you don't put a tourniquet on and they need it, the person will bleed to death. So we can handle taking tourniquets off and saving limbs very, very well. So I don't want you to be afraid of that. Okay. Using a tourniquet can be the difference between life and death. So use it. Right. Which, whatever limb it is that we're working with, leg or arm, it doesn't matter. We're going to put it on the upper part of the limb and we're going to tighten it down, tighten, tighten, tighten until the bleeding stops. And then we're going to secure it wherever the bleeding stops. Okay. We want to note the time of placement. That is important. We do need to know how long the tourniquet has been on there, and let EMS know when and where you place the tourniquet when they arrive. Don't cover it up with their clothes. Don't cover it up with a blanket. We want to make it obvious that there's a tourniquet on them. All right. And make sure you talk face to face with whoever it is that you're passing this person over to in EMS, and point to it and say, there is the tourniquet and this is what time I put it on. We don't want this to kind of get hidden in all of the mayhem of the situation. All right. Burns. All right. Major burns. I'm talking major burns, not like a sunburn type of thing. Again, make sure the scene is safe. So depending on how this burn occurred, we might be dealing with a scene safety issue. So ensure that you're in a safe space. Protect the person from further harm. Okay. If you can do so safely, make sure you remove the person from whatever it is that's burning them. For electrical burns, make sure the power source is off before you approach the burn person. And if you're unsure, you're like, I don't know if the power's off, just leave it. Don't, just stand back. I don't want anybody else to get an electrical burn. So just leave the situation as it is until professionals can arrive and assess if the electricity's been shut off. Make sure they're breathing. And if needed, begin rescue breathing if you know how to do that. This is something that dispatchers also can talk you through. Remove jewelry, belts, and other tight items, especially if it is around the neck or a limb, okay? Because they can start to swell rapidly, cutting off circulation to the rest of that limb. So let's take all of the jewelry off. Cover the burn. We're going to cover it with very loosely with a piece of gauze or clean cloth, whatever you have available. Raise the burned area, excuse me. Lift the wound above the level of the heart. Again, this is just going to help with the swelling if it starts to get swelling. And then we're going to watch for the symptoms of shock. We already covered them, but let's do that one more time. Cool, clammy skin. I don't know where anything went.
Sorry.
They have a weak pulse, they shallow breathing, they're complaining that they're getting dizzy, they complain that they're cold or they're shivering. All of these things indicate that they are in shock and we should treat them for shock. All right.
Okay. All right, so I think this is me, and I'm actually trying to respond to, these tourniquets are not in the AED kits. I just wanted to let you guys know. So I'm just going to respond to that real quick. Sorry. And we'll go into that further later too. So I'm still waiting that someone's having a seizure. So these are some do's. What you want to do if someone's having a seizure, you do want to protect the person from injury. Move furniture away. Make sure and I'm kind of going to jump in, make sure if they are going to the ground, make sure they fall safely. Move the person only if they are in a dangerous place. And once again, scene safety, you've got to monitor that because you can't be a victim as well. Kind of back to protect their head from injury. So if you can, what we worry about too is if they have a spinal injury, you can roll something little and just slide it under their neck. But don't lift the head. Don't do anything that that could compromise their spine or airway. As soon as convulsions have ceased, turn the person to the recovery position to help clear the air. So left side, turn them and sit behind them or stand behind them. So in case something does happen, you don't get anything on you. So you can just kind of, actually, I know the person there is in front of them. I usually stand behind so that I can roll them back. Um, but, and then, and Samantha, your thoughts on that too? I'm gonna throw that out there with you since,
Yeah, I mean, yeah, I'm usually on their backside,
yeah.
I think, as a rule. Yeah, now that, well, you made me think about it, Michelle. I don't know. It's just instinct, you know that.
Yeah, yeah. Well, it depends on where you are. I mean, if you can, but depending on the situation too. I mean, get them on their side so they don't aspirate or they don't choke if that is going to be a potential possibility. So
Yeah.
yeah, but just keep in mind as a preference to me, yeah, I go to the backside. I go like right to their back. But thanks, Samantha. um,
Well, by being on their backside, you can use your knees to prop them up too. Kind of gives you a little bit of an assist right there.
yeah. Um, so speaking a calm voice, reassure them that help is on the way. And once again, I mean, even though they may be unresponsive or not talking with you, they, assume that their hearing's intact. um, so a couple of don't put anything in the person's mouth or force anything between their teeth. They cannot, they won't swallow their tongue. I mean, I don't know. I think that message has been so much clearer through the years. But for any of us, I like to say vintage because we've aged very finely, I guess. But that's always been a big thing. That used to be a big thing when I was younger. So also don't restrain the person. Let them do what they need to. And because it is a seizure and they are gonna convulse here. Okay, let me see if I do that. I'm still waiting. So after the seizure, the victim may not immediately become responsive. It's called post-ictal in medical terms, but they're usually very tired. They may not respond to their name. It takes a couple minutes to become responsive. But just know that that it'll just give it time. In an emergency, 1 minute seems like 50 minutes. So just remember to breathe. Um, they may have lost control of their bowel or bladder, and they may go into another seizure. So just being present, being there is going to make a huge difference. So, and then our next one here. So diabetic emergencies. Uh, it can be too high or too low, but typically we see low blood sugars. So possible symptoms are loss of consciousness, pale, cool, moist skin. And like I said, that some of that is if you're not even just low blood sugar, it can be high as well. A lot of the symptoms are similar. But follow loss of consciousness guidelines. So if victim is conscious, what you can do is typically they can let you know if I'm diabetic. People know because their sugars may be too high or too low. If it's too high, if it's too low, then yes, you can help find some food to get to them. Um, but once again, if it is too high and you give them food, but if they're talking to you, work with them because they'll know. Um, if you know you have a coworker taking insulin, keep some sugary snacks and drinks around. But once again, just it is a tricky one. I can't say but if they do have a glucometer, it's a good thing to test. There's so diet trends and technology with diabetes has come so far too. So some people will know if they're too high or too low. So that's helpful too. But we're hoping that if they are having symptoms of loss of consciousness or if they are pale, okay to still call 911 because they're still going to need some care later. So here we're going to go over now. I'm still waiting. Possible poisoning, overdose. So once again, if someone is kind of back to you're going to see different symptoms, but a lot of times if they get to the point where they're unconscious, then a couple things to consider. Uh, is if they swallowed poison, remove anything. If you happen to see the poison, remove anything. You don't want to stick your, but if it's household cleaner, this or anything here, if there is something here, you want to get the poison away from the person if possible. If it's on the skin, and I kind of going to fall back to scene safety usually. I mean, make sure the scene is safe. If you're doing anything like this, it is a good idea to have personal protective equipment, but if you don't have it, it could potentially be someone's life. But I'm going to reinforce personal protective equipment, gloves, maybe getting a piece of cloth or something, or just to do that, to make sure you can do that. So poison on the skin, remove any contaminated clothing using gloves, rinse the skin for 15 to 20 minutes. It's if you're able to do that. A lot of this from this particular slide is if you're out and about at home or doing that, or even in a lab, right? In a lab class. Poison in the eyes. Many of our rooms do have the eye flush stations. Get to the person to an eye flush station. Just diluting with water is an amazing tool. So diluting is great if you can do that. Button batteries. So if someone has kids are good. Those button batteries are so tiny. If you suspect anyone has swallowed any of these batteries, call 911. Or certainly get them to where they can go. They need to go to the emergency. So that is, they need to get there. Okay. So I'm still waiting possible poisoning overdose. Some people do have medicated patches. And if they have a medicated patch on, and let's say they take something else, this could be, in this instance, it'd be like an overdose. They could, if it's any opioid, they could stop breathing. So that kind of goes in with what we're going to cover at the bottom there. But we'll continue. So if they inhaled poison, get the person fresh air as soon as possible. If the person vomits, turn their head to the side, kind of if they're laying down, turn to the side, make sure that, because we don't want them to choke. Begin CPR if person shows no sign of life. You can call poison control. I actually have, I don't know if I can grab it here. I can grab it. I actually have this thing. I've had it for years. In the ER, we call poison control all the time. It just isn't, even as an example, like even if someone has, let's say they were overdosed with silly as this is, an antibiotic, you can still call poison control. They are a wonderful resource to get instructions with what to do with anyone. Have someone, and if they have pills and other packages and bottles, gather all those pills up and make sure you seal it, and you can give it to EMS when they get there. So I'm trying to look at time as well. So if it's with having this much time, I do have a video on as Samantha mentioned, we do have, we had Narcan and naloxone, Narcan in the student health and wellness centers. You can pick it up. What we do, may ask you for your ID number, but that would be it. We by law have to, there are state laws that state that California community colleges, CSUs, UCs, have to have it available. And so we do, which is great. And it's actually saved lives. It's a wonderful, unfortunately, it's a wonderful tool. And it is heartbreaking that we have to use it, but it is there and it has saved lives. I'm just going to reinforce that. So you can pick up Narcan in the student health center. Just come on by and pick it up. We also, just a little plug here too, is we are going to be providing it's drink spiking test kits too. So we have that there, and we also have fentanyl testing strips. We just did the opioid and drink spiking presentation a little earlier, but yeah. So if you have any questions about that, don't hesitate to contact us, and we'll get you any information you need. But I think for time, I'm going to go ahead and skip the video, and we'll go on to the I want to get to Monica here because she has some very valuable information on mental health emergencies.
Yes, so we're going to briefly pivot to talk about mental health emergencies on campus. So when to call 911 for a mental health emergency, especially if it's immediate danger to self or others. So these are appropriate examples. So the first one, if someone is trying to actively end their life in front of you, so maybe they just took a bottle of pills, or they are threatening to jump off a high building or have a weapon. Or if someone is actively trying to hurt someone else, so they have a weapon, always call 911 in this situation. So some tips when you are calling 911 for a mental health emergency. First and foremost, stay calm and breathe. So just as Michelle mentioned with that 4-7-8 breathing, that's going to be a really helpful tool, or any other breathing techniques you can utilize. Definitely stay calm in the moment as best as you can. Give as much information on the situation as possible when you are speaking to 911 or any other personnel. The next thing, be honest with the individual. Let them know that you are worried for their safety. Police are there to keep them safe. You're there to keep them safe. So really providing as much compassion and support as you can in that moment. Lastly, assure you and others are safe. So in a moment or situation where safety for others or yourself is at risk, definitely remove yourself as best as you can. Michelle, it went away. But I have it in front of me, but do your best to remove yourself from the situation, especially if you feel it's highly unsafe. Right, and so the next slide. So this is an instance of when not to call 911, but who you can call in another situation. So take any threats to harm to self. So anyone who's thinking or verbalizing through written art or behavior or assignments, or maybe alluding to harm to others. So any aggressive or violent tones towards others, again, through verbalizing it, written on assignments. We want to take those very seriously. So again, you want to get help immediately. So finding the appropriate source of who can help you. So if it's not going to be 911, we want to follow the suicide intervention and formal risk assessment, which I can go into detail in the next slide. But for now, we would follow the suicide intervention and formal risk assessment protocol for CRC. If you are at CRC, you will contact the crisis counselor of the day, and there's the phone number, or contact the Student Health and Wellness Center for support. If suicide risk is not presented, you can reach out to your campus behavior intervention team. So at ARC, it's CAS, so the crisis assessment support team, or at CRC, the BERT team. So if the suicide risk is not imminent or a danger in the moment and just need some follow-up support for the student, that would be the best case scenario. And again, some helpful tips for yourself: stay calm, use your breathing techniques or whatever can help you stay calm and present in the moment. Act on your instincts. Instinctually, you will kind of know what to do in that situation. So trust your instincts. Avoid keeping it a secret or making promises. So going back to the previous slide, being honest, being transparent with why you're wanting to keep the student safe, or why you would need to call police or bring in any other support. That's just going to be the best thing you can do, and not to keep any promises that could be detrimental to the safety of themselves or others. And lastly, do not judge your reaction. So again, being compassionate with yourself with how you react in the moment. This can be a really distressing situation, of course, for a student, but also as a staff member to be in. So, just also have compassion with the way you react in those moments. All right, and then on to the next slide. This is the LRCCD Suicide Intervention Informal Risk Assessment that I was referring to. So just as a reminder, this is a district-wide protocol, but sometimes each campus may have their distinct differences based on their teams and then the level of support they can have. So for example, CRC is still formalizing their final version or their process of this. But just to briefly go over this with all of you, on the left-hand side, you'll see this is what you can expect if a student is experiencing a psychological crisis. If a student is expressing suicidal ideation, so harm to self, again, whether they're thinking it, verbalizing it, writing it, or expressing it through art or behavior. Examples, if a student is expressing or verbalizing, I want to die or I want to kill myself. For homicidal ideation, so harm to others, again, looking out for aggressive and or violence towards others. An example of verbalizing is I want to hurt someone or I am going to hurt them, and having an identified person that they would want to hurt. And then a student who may be gravely impaired. So maybe you're observing that they're confused, they're agitated, disoriented. Maybe they're expressing that they're hearing or seeing things that other people cannot. So maybe experiencing some hallucinations or disorganized thinking. And just overall seems out of touch with reality. These are all examples of a student who is experiencing or potentially experiencing a psychological crisis. So in the column right next to it in teal, this is if the student is an active and imminent risk or danger to self or others. So below, these are the steps that you would take. So if student is threatening to end their life or someone else's life in front of you and has the means, so either they took the pills to overdose, or they have a weapon and are verbalizing that they will act on dangerous behaviors, the next step you should do is, if you're physically with the student, remain with them or provide a warm handoff. So you want to connect them to the appropriate services. So calling LRPD, and there's the number there. Or if you access the Safe app on your phone, there's a button there that you can click it right away and you can contact someone on the spot. And then you will need to provide the location of the student and where you are. And then lastly, what you can do afterwards is notify the Health and Wellness Center and your dean immediately to connect with a trained district staff member, and especially if any follow-up is needed. In the column, the third column there, so there's an identified risk, but it's not imminent. So for example, student has an identified psychological crisis through thinking, verbalization, written art or behavior. The next steps that you would do is, when you are physically with the student, remain with them. It could also be helpful if you need to make the call to have someone else there with you as well. So having support can be helpful, but try to remain with the student. Immediately provide a warm handoff to counseling or the health and wellness center. If the student is not present, immediately contact the Student Health and Wellness Center to refer them or notify your dean. So if you're noticing a student and this is virtual and you don't have immediate access to them or they're not in front of you, you can contact the Health and Wellness Center just to present your concerns. Lastly, if student is with you and you're able to get in contact with the Health and Wellness Center or LRPD, an LRCCD approved risk assessment will be conducted by a trained district staff. And so this can help with determining the level of risk and developing a safety plan for the students. All right, and then lastly, in that last column there, after hours protocol. So if the concern is after hours and campus staff is not available and the facilities are closed, please call the Health and Wellness Center on the next working day just to give an update and maybe if there's a follow-up that is needed. The next steps, provide students with crisis resources and call emergency contact if listed. So if you look to the right-hand side of that, there is an arrow to that lime green that has the crisis resources. So you can provide this to the student. So they can call the Suicide Prevention Lifeline, which is 988. They can call or they can text the crisis text line at 741-741. And then below the Sacramento PD not emergency hotlines there. So these would be some good resources to share with the student after hours. So then going back to the left, after you've provided the resources to the student, if the student or emergency contact cannot be reached, call LRPD at that number to do a welfare check or wellness check on the student. All right. Yes, and at the bottom, if you're not certain of the next steps, please consult with your dean or your campus health and wellness center team. So just remember, you don't have to support the student alone. You know, that's why we're all here and being able to collaborate and offer that support when needed. Next slide.
All right, so if you haven't figured it out yet, I'm going to point out some of the common themes I think that we've been talking about during the last hour, just to kind of highlight them. Some common things you probably have noticed is ensure you and your victim are safe. I can't emphasize that enough. Make sure everybody is safe, all right? And if it's not a safe scene, situation, area, whatever, get out of there, all right? And keep yourself safe. If you're unsure what to do, call 911 and then Los Rios Police Department. If you're just like, I'm not sure, if that question even comes into your thought process, then yes, the answer is yes. Call for some assistance. Stay with the person needing assistance. All right, we don't want to abandon them and walk away from them. Encourage the victim to relax and be present, be that calming force for them, because if they're in a crisis, it can be very stressful for them. Allow the person to be in any sort of position of comfort that they feel is going to be the best for them. This will help them relax. So if they want to stay sitting, that is fine. They want to lay down, that is fine. Whatever is going to help them be comfortable. Again, that will also help keep them calm. All right. Keep reassuring them. Let them know that you have called for help. Let them know help is on the way. And then if you have it available, use protective equipment to protect yourself if it is available. Okay. And especially if you're dealing with bodily fluids, I would definitely try and get some protective equipment as soon as you can. Yeah. Next, Michelle. So what can you do to be prepared? Congratulations. This is a great first start. If you haven't been exposed to any of this yet so far, this is a great way to get started. But some other things to do to be prepared is check for first aid and CPR classes in your community. Even if it's just for your own information, your own knowledge, okay? Some things I like to remind, especially my students, is knowledge is power. It helps aid in confidence in these situations, and it aids in feeling prepared. And if you feel prepared, and you are faced with one of these situations, it will definitely help you stay calm and in the moment. As we already talked about, download the Safe LRPD app onto your phone. Do it today, do it now, and you get it all logged in. Don't ever be afraid to ask for help. You should never feel like you have to do any of this on your own. There's a lot of help out there for you. Even if you just scream into the air, help, someone will come and help you. All right. Pick up some Narcan and gloves at the Student Health and Wellness Center. They will gladly provide you with those materials so that you have them available. And then check the map for your local campus and find out where all the AEDs are, especially the ones that are near your office and your classrooms. And that way, if you need one and you have to send a student to get one, you can direct them right where to go to get one. Yeah.
And a question, do you guys want, do we want to see the app? If I do this, I can click it now. I love technology, everyone knows. But would you like to, Samantha, Monica, should I show it real quick? Map locations.
Sure.
Okay.
Looks like we have time.
Okay. Oh yeah, we have a few. So, and as you see on here, anywhere we have a, and I'll make this a little bigger. Anywhere where we have the heart with the lightning bolt is where we have AEDs on campus. And so, so that's one place you can look. So let me go back here. Okay. And then I'll go to the next. All right, and actually it comes to me with the next slide too. So if it's not a 911 emergency, some examples: back pain, cold, flu, fever, crying, insect bites, mild abdominal pain, mild injuries, mild cuts. It would say most mental health concerns, but keep in mind, I know with CRC, we're one campus that doesn't have student health, and we aren't co-located. Physical health and mental health are not co-located here on this campus at Cosumnes River College. Nosebleeds, nausea, vomiting, diarrhea, rash, sore throat or cough, sprains or strains, urinary tract infections, sexually transmitted infections. Send them over to us if it's not an emergency. And if not, also an emergency, what to do. So what you can do is visit your student health and wellness centers during hours of operation of care. Unfortunately, we aren't here 24/7, but typically on each of the campuses, we're here Monday through Friday, or Monday through Thursday. So we're here on campus. If transport to student health and wellness is needed, use the Safe Los Rios app and connect with LRPD to get campus patrol. Or you can call the 916-558-2221, which was a number that used to be all around the campuses before the app. If you do call the number, actually, even if you've used the Safe Los Rios app, it's going to take you to that number. Please, please, please remember to press 0 right away. Otherwise, you'll go to a phone tree. So just know that as you use that, press 0 to connect with an Los Rios Police Department dispatcher. If you're injured or ill, if the injured or ill person is refusing transport, what you can, I mean, if it's not, like I said, not a 911, encourage or assist them with calling a family friend to get them the care that they need. And sometimes just kind of being there with them and just, hey, what can I do let's get someone here to come help you or to come get you, makes a big difference if you can't get them to us. And at this point, I think we are at questions. So I know that there have been some good questions in the chat, and I know we've all tried to answer them too. So at this point, and even just looking over at the last question, Chris Rains did point out, and we talked about it earlier, if once EMTs are on scene, be sure to just give them space and room to do what they need to do to help the person that needs care. So also here, I'm going to drop the Narcan video in the chat. Also let everyone know that we'll put the slides together as a PDF, and through professional development, we'll have the recording and the slides available to thank you, and the link to the Los Rios Community College District Student Health and Wellness for those of you that want to know if that chart is somewhere. That chart, it will be the chart is the mental health chart is on the district, but for Cosumnes River College at once has some we have crisis counselors of the day, so we're incorporating that within our protocols. So that will be coming out shortly, just to let anyone at Cosumnes River College know. And I also want to put in the Narcan video. So I am going to stop sharing my screen, and then I will put the and just to know that here's the website too, but I'm gonna stop sharing my screen so I can get the Narcan video in the chat. And if you have questions, go ahead and put your hand up, or write it in the chat, because we're here. And I'm gonna say, if we don't have any questions, and I'm not seeing anything, just to know that, I mean, you can connect with, you can go to the website, connect with us if you do have any questions. Thank you, Samantha, for doing this with us. Appreciate you. Monica's from ARC. Oh, I have a hand. John has a hand. John, go ahead and take yourself off of.
I am.
Cool.
Thanks, Michelle. On the last slide, you said if the patient refuses care, should we get recorded either on 911 if they record the call or something? Because I've seen people try to come back saying you didn't offer help, and we said you declined it. So without any proof that they declined it, are we on the hook for their extended injury or
And nasal spray is emergency treatment for a known or suspected.
Sorry.
I'm sorry, I just wasn't sure. Because I don't want to be on the hook for them declining care at the point of injury. And even though we tell them to follow up, they try to come back days later and say, you didn't do your job, or you didn't do anything, when we said we offered it, you declined it. But then it becomes them versus us. So if we can call LRC, the Los Rios PD, and I'm hoping they record all their calls, we put on speaker and say, hey, you need to go follow up, and the person says they decline, we have a record of that. Or should we put in writing date, time, saying their name, the incident, we recommended follow up, and the patient declined to be taken in. We've done our due diligence. So I'm just trying to say, cover ourselves, so against any future complications, say we offered, you declined, so responsibility is now yours.
Yeah, I would recommend documentation all the time. So if you did have a student that refused care, and are you saying refused care is EMS came, or they said don't call anybody, I'm gonna go?
Yeah, if EMS came, they'll do the documentation because they went against medical advice. But if we're a teacher in the classroom and they don't want us to call, I said, you sure you don't want to? Record it, document it, and that way, if they come back saying all these complications occurred because you didn't do anything, and we said we offered and you declined, we have at least a leg to stand on. But there are a lot of people that are not medical and not people aware of documentation, these unusual circumstances. And I agree with you. We should document, but at least put the date, time, the incident, name of the person, and that we offered and they declined, and then keep it off in case something comes back. At least we have something to record to show that we offered and they declined.
And
But
I'm also always going to encourage that talk to your dean, talk to your let your area know as well. And I think with the with having it just, and then you can work with your dean as well on
good
it,
point. Thank
yeah.
you.
Okay. Any other hands? I can only I love technology. I'm not gonna lie. It's a fun challenge for me. So I have to try to. I don't see any other hands. I know it's 12:16. Everybody, reach out to us if you have any additional questions. And I just want to say thank you all for coming. Monica, thank you, Monica from ARC. She came and helped us out today because our CRC person was busy doing something, so it was good. So thank you, ARC, and thank you, Samantha. Thank you all for attending. And yes, okay, review and CPR. If you guys can, we don't have a class per se, but every community does have CPR classes available. For now, if you can you can go to the American Red Cross. You can go to if you Samantha, I know I usually go through American Heart Association for my CPR because I have to do basic life support. Do you have any other suggestions for CPR classes?
No, American Red Cross and American Heart Association are two big ones. If you actually live here in the region, like in Elk Grove, I know Cosumnes District puts on CPR classes for the public all the time. So keep an eye out for those. Fire departments do them. We are trying to work on getting them on our campus. We are in discussions. We know it is a need. But if you also have any questions of where to find one, or if you found one, you want to know if it's a good, a legitimate one, feel free to contact me. I can take a look at it and give you some guidance on that.
Well, I'm gonna say for now, thank you all again for attending, and